Right then, evening. Thanks for coming. Before I start, my name's Ian Gawdy. I'm working towards my accreditation to be able to deliver first aid courses, and this recording will be used as part of my teaching qualification. What I want to do before we start, if it's alright, is just to quickly go round the room and ask you to say what your first name is and what experience, if any, you've got with first aid.
Hello, I'm Kobe and I've got some experience with first aid, and I'm a community psychiatric nurse, so I have to do it regularly.
Welcome, Kobe.
I'm Tom, first aid when I was back at school, some 20 years ago, so not really now. No.
Okay, welcome, Tom.
I'm AJ, some first aid, but about 6+ years ago.
Okay, welcome, AJ.
I'm Ben. I'm SJA qualified, but haven't had to practice anything yet. So.
Okay, cool. Welcome, Ben.
My name's Michelle, without a lot of
Whoa!
voice. Yeah, I have first aid and I have been for the last about 26 years.
Okay.
And also surgery manager, so I do it regularly as well.
Okay, welcome, Michelle. Your throat's a bit sore by the sounds of it. So if at times when we have to do some of the bit of role play, if that's difficult for you, you can whisper. We won't mind that at all.
I'm Alex, I've got no experience.
Oh, welcome, Alex. That's all right. You don't have to have any at all, because as you can see from my slide up there, we're terming it as first aid for beginners, so that's fine. So we start with the introducing me bit. Have you all filled in the pre-assessment sheet that I sent you? It's already asked you on that sheet if you have any previous experience, but there's also some questions on there relating to whether or not you need any additional support at all. So thank you for filling those in. We've had a look at those. A few bits about general safety to begin with. The fire exits are over here on my right, and there's another fire exit at the back here, and over here on the right in the middle of the room. And the muster point is the area outside the building on the grass. And if we, for any reason, have to exit the building, we don't come back in until the chief fire officer or the person in charge tells us to do so. Interestingly enough, we always say to leave the building in an orderly fashion, but you can see the sign above it. That bloke up there looks like he's running for his life, doesn't he? Which is a strange sign, really. So yeah, keep it nice and relaxed. If there's any questions as we go along, just pop them up. That's fine. There will be plenty of opportunity to ask questions. If you're concerned about the NASTEC and your shares, and you have to have your phone on, that's fine. But it would be handy if your phone was off, so we can be part of the team. So we're all sort of different here. Everyone's got something to contribute. So some of us are a little bit more vocal than others, but let people contribute, make sure they're all listening to each other. That would be great. The next one's a classic. It's a good one. I've got a couple of surprises for you. The next one says, "Would you like a new Mercedes?" Well, that's the first surprise, is that there is a summative assessment at the end where there's a few questions to answer to see whether or not I've done my job well and that you remember some of the information. The second surprise is there isn't really a Mercedes. It's just to hopefully get you set up right. And to make sure, as I said, you've done that introducing me sheet, and providing everyone's happy and comfortable, we can crack on. All right?
Yep.
Okay, so what we're here to do this evening is we're going to understand the principle of first aid. It says principle. Well, it's principles, really, because obviously there's lots of different elements that come into first aid, such as burns and breaks and cuts and bruising and a number of different issues that we might face. But really, in all, what we're aiming to do is to sort of burn that down a little bit today and come up with two very important elements, which we'll get to in a second. We're going to be aiming to perform an effective primary and secondary survey. That's the process that we're going to go through if we come across a casualty that we think is going to need our assistance. To be able to put our casualty in an effective recovery position, which is a safe position leading to keeping someone's airway open, which I'll get to in a second, and also allowing drainage from the casualty should that be an issue, and to be able to perform effective CPR, which is cardiopulmonary resuscitation. That's when someone's heart's not beating normally, and we need to take over that action on their behalf until the emergency services would arrive. So the first question, golden question, is what would you understand to be the definition, if you like, of first aid itself? So what I'm going to ask you to do, just with the person next to you, it's going to give you around about 30 seconds or so to have a quick chat and see whether or not you can come up with what you think the definition of first aid is. Okay, so off you go. So if you can make a note of it with your pen and your paper you've got if you want. So just your own definition as to what you think first aid is.
Something like that. Yes, somebody knows what they're doing.
Basically, yeah. So, sorry, first response. So you make that. Yeah, I see what you're saying there.
Yeah.
Can't be funny. It's got to be,
Medical assistance.
So how are you going on? How are you getting on? You think you got something?
It's
Okay.
not always waiting.
So what did you have here?
We had providing immediate care or immediate basic care to prevent loss of life and reduce further injury.
Oh yeah, that's a cracker. Yes, good start with that one, most definitely. What do you have, guys?
First response to someone who requires medical assistance.
Yep, like it. And Alex, you?
We've got first initial response to help someone who is sick, injured, or in need of that help.
Pretty good, yeah. Help given to a sick or injured person until full medical treatment is available. We all watch the news, don't we? We know that the NHS is under all sorts of pressures. So really, the more people that are first aid qualified, especially for the elements that I'm going to show you tonight, the better really. Because although they have to obviously triage with ambulance care who they come out to and in what order, and obviously anything that's described as perhaps a heart attack or an issue such as the issues that we're going to deal with tonight. But the more people that are first aid qualified, the better. So yeah, we did that. We did well with that. But we're also, when we sum up first aid, we tend to be able to put it into the sacred 3 Ps. There's three Ps that words begin with P. It's an acronym to help you focus your mind on exactly what the reason or what the main aim of first aid is. So would anyone like to have a crack at what they think the first P might be?
Prevent.
It's not prevent, no, strangely enough. It's not prevent, no.
Preserve.
It's preserve, yeah. The first P of first aid is to preserve. Preserve what?
Life.
Life. To preserve life. Whose life?
Both.
Both.
Yeah. It's both the casualty and yours. Yeah, because obviously what you don't want to do in the assistant of a casualty is to become a casualty yourself. And we're going to look at that in a second when we go through our primary survey. Second P, Alex,
Prevent.
is prevent. Absolutely spot on. To prevent a worsening of the condition. So what would be an example of how you would prevent the worsening of a broken leg?
Stop them moving.
Yeah, stop somebody moving. So if someone's broken a leg, and you say, jump to your feet, you'll be alright, and we'll jog up the hospital. As the leg moves, it creates more damage. So the idea is if someone had, for example, a broken bone, one of the things that you would do is to keep them still to prevent that injury from worsening. The last one
Promote.
is to promote. Promote what?
Recovery.
Promote recovery. Give us an example of how you might promote someone's recovery.
Ice, putting ice on some.
Yeah, that's right. That's definitely one.
Elevation.
To elevate an injury is another. What's the biggie?
Get them to hospital.
Get them to hospital. Okay, especially in severe cases, get them to hospital. Okay, because none of us are doctors.
Okay.
Yeah, none of us are doctors, and none of us are gifted healers. Okay, so yeah, definitely without a shadow of a doubt, get them over to hospital. Okay. So what we're going to look at now is this primary survey. Some of you might be familiar with it. We're going to do a bit of a practical and get you out of the chairs in a second as well. It does involve a little bit of acting, okay, which is all right. The primary survey is the first thing that we would do when we come across a casualty. So in this particular incident, as you can see from poor Annie over there, she's remained very quiet and very still for quite some time now. When we're coming across an incident, we go through this acronym here of Dr. ABC. This is the sort of main priorities that you need to be at the forefront of your mind whenever you're coming across an incident or you're coming across a casualty. The first is danger. Okay? So when you're coming across a casualty and incident, how would you assess danger?
Look around.
Yeah, you look around. What would you be looking for?
Traffic.
Risk.
Yeah, risks. Anything that may cause a problem to you. What else? What else might you do?
Either like hazardous materials.
Look for hazardous materials, yeah. Not only the ones that you can see, but the ones that you might be able to smell. Right. So if you're coming into a room like this, there's an unconscious casualty in the middle of the room. It's a very strong smell of gas. What might you do?
Take them out of the room.
Take them out of the room?
Take them out of the building.
Open the windows.
Whose life have you got to preserve?
Call the fire brigade.
Fire brigade.
Theirs and yours, okay? So perhaps we might consider that in a situation like that, you've got to consider your own safety, okay? Because otherwise we end up with 2 casualties, okay? So in a situation like that, you'd definitely be alerting the emergency services, and you'd be trying to find the gas main, wouldn't you? See whether or not there's any way you can turn it off. So that's danger. Then we would look for a response, and we very often use this acronym here, and we're going to have a go at this in a second, of AVPU. And when I show you it in a second, it may make it perhaps a little bit more sense. This is alert, voice, pain, and unresponsive. And this is where we check our casualties to see whether or not there's a response. And a lot of people are very familiar with this, okay? Because without these things working or being in order, life can't be sustained. So the first thing we need to do is to check somebody's airway, to make sure that the tube that someone takes air into the body doesn't have an obstruction in it, okay? When might someone get an obstruction in their airway? Choking, yeah, that's right. So if you're a parent of small children, cut your grapes that way, don't cut them that way, okay? Cut them lengthways, don't cut them across, okay? And that way is less opportunity for grapes. And obviously don't leave children unsupervised when they're very young to eat, okay? Obviously breathing, because life can't be sustained without somebody breathing, and circulation. Somebody, if their heart's not beating, and it's not pumping blood around the body, then someone's going to need further assistance from you. So, we're going to have a little go. We jumped out of our chairs. We're going to come around here to poor Annie. Okay. So, for the purposes of the filming that we're having, obviously if we were teaching this for a real course, we'd all have to do it because it would be part of the assessment to make sure you can do it. But if we rather not have a go with CPR for any reason, that's absolutely fine. So what we talked about, we're glancing up there at the screen there so that we can get an idea. So here I am, I'm coming across this casualty. There she is, she's not looking too good. What's the first thing that I'm going to do?
Check the danger.
So I check the danger. So I'm checking the area to make sure that there isn't anything that might cause a danger to myself. And the second thing that I'm going to do
Check the response.
is check for a response, okay? And this is where your AVPU comes in, okay? So we're looking for alert, we're looking for a response from her, and I'm going to use my voice to see whether or not there's any response, to see whether or not she's alert. The way that I do that is I make some noise either side of the head, and I use my voice as well to see if I can get a response. Hello, can you hear me? Open your eyes if you can hear me. Now, why might I clap both sides of her head?
So not deaf.
Yeah, because somebody could possibly be deaf in one ear. So I make sure that I'm giving some command to both sides of the head to see whether or not there's a response, okay? The next one is pain, because sometimes at any level of consciousness, people can respond to a little bit of pain. Now, obviously, you can't be, giving it pain to a high degree, but a pinch of the ear. And the other thing that you can do as well is just place your fingers just underneath the collarbone here, and as you're giving your voice command, you can be pressing with your thumbs. Hello, can you open your eyes if you can hear me? Open your eyes if you can hear me. And I have an unresponsive casualty, okay? So, what's my next priority? The airway, okay? So to check the airway, if you can move around so you can see, all I'm going to do is just place my hand at the top of the casualty's head, or my thumb on the chin, and I'm going to open the mouth, okay? And I'm going to have a little look inside the mouth to see if I can see anything in there that could be blocking their airway, okay? Now you have to be careful putting your hand in people's mouths, okay? But if you see anything in there and it's possible for you just to be able to hoik it out, the reason that might happen is sometimes if people choke, what happens is when the body gets starved of oxygen and they go unconscious, all the muscles relax. So there is a possibility that you might see something, okay? And the next thing I'm going to do is check for breathing. Now when I check for breathing, I'm just going to tip that head back, okay? Because what this does, it has an effect of opening the airway because of the muscular structure of the tongue. And then I'm going to put my ear and my cheek down towards the mouth and the nose. And the reason I put my cheek is because this is a sensitive part of my body, and as luck would have it, it's quite close to my ear. So I'll be able to listen and feel and see whether or not I can see with my eyes along the chest. I can see if the chest is rising or falling, and I can feel on my cheek, or I can hear as to whether or not there is any breathing. Now, at this particular point, you have to do this for around about 10 seconds. Which quite frankly, ladies and gentlemen, is the longest 10 seconds of your life. Because even in a very deep form of sleep, someone will breathe at least once every 10 seconds, okay? Now if I get no breathing, the casualty's not breathing, what do you think would be the next? Yeah. The next thing I'm going to do is get help, okay? Now how might I get help?
Right, going 911.
So I can call 911 or 999, and I can have my phone on speaker and place the phone next to me, okay, and I can start that conversation. When you get through to control, they're going to ask you a number of questions, where you are, what's happened, and what might you say? When they say, what's happened, you're going to say, unconscious, unresponsive female, yeah, and they don't appear to be breathing yet. Now the good news about modern technology is because your phone's on, they know exactly where you are. But you still need to be clear as to what address you're at so that they can give every opportunity, which is very important, we're going to get to in a second, that they can get to you as quickly as possible, okay? So I'm going to get help, or I'm going to call for help, or I'm going to go and get help, okay? And then when I return, I'm going to need to then do what? CPR. I'm going to need to do CPR. Now it's perfectly okay if someone has their clothes on, but if you are in a situation where you're going to need to give somebody CPR, you're better off getting up close and personal, okay? So it can be done with clothes, but removing the clothes either with a pair of first aid dual scissors, or if you can, if it's possible, don't start trying to pull people's t-shirts off over their head, because that's not going to work, okay? But if you do remove the clothes, that can be better. I'm going to place the palm of my hand along the line where the base of the shoulder goes across the chest, just in between the nipples, on the centre of the chest, and I'm going to lace one hand on top of the other. Keep my arms nice and straight, and I'm going to do 30 compressions. And we're going to get into the habit of counting them when we do them. And it looks like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now it looks quite brutal. It has to drop the chest 5 to 6 centimetres, and it has to be done at a rate of between 100 and 120 beats per minute. Okay? 30 compressions. And then I'm going to give 2 breaths. Place my hand on the forehead, pinch the nose, tip the head back, open the mouth, and I breathe. You don't have to breathe like blowing a balloon up. You just have to make a seal with your lips and breathe out with a gentle force. And as I do that, you'll see that the air will go into the casualty. Now, in between breaths, you can see that I come away from the casualty and I watch because I want to see the rise and fall of the chest. And I give 2 breaths. Then I come back to CPR, hand goes into the middle of the breastbone, lick the fingers, the arms straighten, and I go back to my 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then I go back to 2 breaths again. So when might I stop CPR?
If they start breathing.
Yeah. One is if suddenly you get a response from the casualty, you pink up, and they become conscious. Okay, that's one reason that you would stop. We never perform CPR on live conscious people. Okay, it's not good for you, not good for your heart. When else might I stop? When the emergency services arrive. Yeah. Emergency services arrive, they're more than likely, or they will, have an AED, which is a machine that gives a shock into the heart, which stops it. Now, the only way that an AED works is if the heart is in one of 2 particular rhythms, VF or VT. If the electrical activity of the heart is making the heart wobble, or it's beating very, very quickly to a rate that can't sustain life. They shock the casualty, they switch the heart off momentarily, and then if the heart is healthy enough and able to, it will then start to beat again normally. Okay? The reason that you need to do this is because without you doing this, there's absolutely no opportunity of that AED working when they get to the casualty. For every minute that person is unconscious, their chance of life diminishes by 10%. So when you hear that, kind of sounds like a light statistic, but if someone is in that condition for 8 minutes, they've only got a 20% chance of survival. So it's very important that you do something rather than nothing. Okay? So I wonder, I'll talk you through it. Anyone's prepared to do their little primary survey here and try a bit of CPR. Tom, you're like a winning label. Come on. Let's see how it goes, Tom. Okay. So you can glance up there, Tom, because it will tell you what you need to do. So first thing you're going to do, you're going to approach your casualty and you're going to have a little check around to see whether or not there's any danger. Good man. And then you look for that response. So voice.
Hello, can you hear me?
Perfect.
Can you open your eyes?
Excellent. And then place your hands, that little press, and then reaffirm with your voice again.
Hello, can you hear me? Hello.
No response.
No.
So we've got a bit of a problem, okay? So we're going to look for an airway. We're just going to open at the chin there and just see whether or not you can see anything in there that might be blocking the airway, okay? Then we're going to look for breathing. So we're going to tip the head back slightly, lift the chin slightly, and we're going to put our ear and our cheek, perfect, down towards the mouth and the nose, looking along the line of the chest to see whether or not the chest rises and falls. And how long would we look for?
10 seconds.
10 seconds, because even in a deep sleep casualty, people will breathe at least once every 10 seconds, okay? There's no sign that the casualty is breathing, okay? The next step is to
CPR.
is to call for help,
Call for help.
okay? So if they're not responsive, and they're definitely not breathing, the problem is, Tom, if you start CPR, you could be there for months, okay? So you need an AED, you need to get someone to call an ambulance, okay? Once that's done, we then need to commence CPR. So, where possible, you might expose the chest. You place one hand on top of the other, centre of the chest, lace the fingers, keep the arms straight, and we look 30 compressions, 5 to 6 centimetres in depth, 100 to 120 beats per minute, and we count out loud when we do it. Go ahead.
1, 2, 3, 4, 5, 6, 7,
Perfect.
8.
What I need you to do, Tom, is go deeper. You're not going deep enough.
1,
That's it.
2,
Get that
3,
click?
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Spot on. Then we need to do 2 breaths. So we're going to tip the head back, we're going to pinch the nose, make a seal around the lips, breathe in, watch the rise and fall of the chest, and the second one. And then we're going to place our hands back onto the chest, and 30 compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Good man, 2 breaths. Tip the head back, hold, Breathe in, and out, and again. And we would go back to chest and breath. Tom, spot on, absolutely brilliant. Anyone else going to give it a go? Come on, Ben. Just a word about Annie. Annie is the most kissed face in history. And Annie's cast was taken from a young lady who was pulled drowned from the Seine at the end of the 19th century. And nobody knew who she was. And a local shopkeeper took a cast of her face, put it up in the shop to see whether or not they could identify her. No one ever identified her, and it was rumoured that the young lady had ended her life in the Seine from a broken heart. So it's quite sweet that poor Annie's face, that is her face, it's a Mongolian face, is now the most kissed face in history. So things didn't turn out too bad for her. Well, maybe they did. So we're going to approach. I'm going to go over here, so put back where you need to be. So you're going to approach. The first thing that you're going to look for, Ben, is?
Danger.
Excellent. You're going to have a look around and make sure that you're safe before you start. After you've assessed the danger, you then assess for response.
Can you hear me?
That's the one.
Can you hear me? Hello?
Good.
Open your eyes if you can hear me.
We might use the little press of the thumb, because pain
Can you hear me?
sometimes can
Open your eyes
stimulate
if you
different
can hear
areas.
me.
Very good. Next thing we know, we had no response, so we need to check whether or not
Breathing.
there's anything in her airway. So before you pinch that, so just on the palm of the hand goes on the forehead, just open the mouth first. The reason being, if you tip her head back, if she's got something here and you tip her head back, it could drop into her airway. So you just open the chin and have a look in, okay? That's good, very good. Can't see anything in there, so now you're going to check for breathing. So we're going to tip the head back, that's it. And he's got ear, cheek, line of the chest, how long?
10 seconds.
10 seconds, okay? And there's no sign of breathing, so what's your next move, Ben?
Got an unresponsive female. Can you call for help, please?
Excellent, yeah. Because people only pop back to life when given CPR on Baywatch. Do you remember Baywatch? Why would people pop back to life given CPR on Baywatch, though? Drownings, okay? There's a slight difference in your approach if somebody's drowning. We won't go into it, but you give rescue breaths first, okay? 5 rescue breaths rather than chest compressions, and that's why sometimes with a drowning it can be slightly different. So you've made your call, you've got your phone on to the side, you're going to get up close and personal with Annie, why not? And we're going to lace the hands up, keep the arms straight. It's best to keep the arms straight because you want your body doing the work, because a couple of minutes of CPR you'll be absolutely exhausted. So rather than using your hands in this fashion, we're going to use the rock of the body. And it goes out loud.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And then 2 rescue breaths. And what I need you to do is give me that click every time you press down, okay? That's it. And lungs, see how the lungs are inflating like that? You see that? And he's looking down the line of the body, he's seeing that, and then he goes into a second, 2, 3,
4, 5, 6,
Side to
7,
CPR.
8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Brilliant. Thanks very much, Ben. That's spot on. Right, any questions on that so far?
Yeah, so then you're saying if you're doing breath,
Yeah.
and the lungs aren't inflating,
Yep.
would that be like something about a fucking lungs, something like that?
Not necessarily. If you're giving breaths and you don't see there's resistance to your breath, that could be a blocked airway. If you see a rise and fall of the stomach, that can be that your breaths are actually going into the stomach, which means you need to tip the head back to make sure you've got this an efficient airway. The other thing that you need to bear in mind is it does need to be a tight seal. The process is slightly different with children, but sometimes if the face is much smaller, your mouth has to go over the mouth and nose, but that's a different technique. Okay? So we come and take a seat then, that's brilliant. Thanks guys. So that's what we've just done. Cardiopulmonary resuscitation. It's Coming on to CPR is an emergency procedure that provides chest compressions, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken. If you do nothing, it's not going to be a good day for them. If you do something, it might be a great day. Okay? And it is one of those things that needs to be practiced and visited regularly. In my own opinion is that qualifying people once every 3 years. If you're subject to it, you're doing it all the time, that's one thing. But if you only do it when you do a first aid course. But anyway, that's it there. So this is that chain of survival that I talked about. It's all about doing things early. If a casualty suffers a heart attack, their heart stops working properly. It's early recognition to be able to call for help. So when you recognise that someone's not breathing, it's about getting help. Early CPR, and then early defibrillation. That's getting that AED on them to shock the heart, and then early post-resuscitation care. And like I said, for every minute that someone is unconscious with nothing happens, their life is diminishing by around about 10%.
If you're doing C4, if you call for help and you know that there's a defib, when would you go and get a defib? Like if you're like somewhere like here, if there was a defib available?
If no one else is around and you know that there is a defib, you need to go and get the defib as soon as you recognise that somebody's not breathing and there's no signs. Even if it's not going to be common, but even if they're pink because they've only just stopped breathing, if they're not breathing, is their heart going to keep going? No. So as soon as you recognise that someone is not breathing, if there is an AED, you need to go and get it. You'll know that when you open them, they're voice prompted, right? So they will tell you what to do, where to place the pads. They'll analyse the patient and they'll tell you when to press the button. Okay, they're very common. They're in a lot of public places now. When you phone the emergency services, they're in a coded box. The emergency service will tell you the code. Sometimes people think, well, how do you get the code? They tell you because they know where it is. And I think as well, as one of the countries in Europe, taxi drivers